In Canada, it has been estimated that 220,000 incidents of healthcare-associated infections occur each year, resulting in more than 8,000 deaths. 8,000 deaths are equal to the combined number of people who die from breast cancer and motor vehicle accidents in 1 year. Outbreaks in long-term care homes can create significant costs for the facility. For example, it can cost more than $12,000 to control a VRE outbreak. In long-term care homes, the cost of treating MRSA, methicillin-resistant Staph aureus infection, can be almost 2 times higher than the cost of a methicillin-sensitive Staph aureus infection. In Toronto at Sunnybrook Health Sciences Centre Long-Term Care, a study showed higher hand hygiene compliance rate lowers the norovirus attack rate. That means fewer people with diarrhea or vomiting. An effective hand hygiene program can reduce the burden of illness and associated costs in our long-term care home. As a healthcare professional, you are already aware of the risk of healthcare-associated infections, and you already work hard to maintain a safe home for your residents. Now, professionals in healthcare all across Ontario are leading the way in a concerted effort to improve hand hygiene. We're changing the way we do some parts of our daily work. In addition, we will be modeling behavior for the other members of the home's team. Hands are the most common way that healthcare-associated infections are transmitted in a home. Even clean activities like lifting a resident, physiotherapy, or checking a pulse can transfer organisms. After contact, these organisms can survive for surprising lengths of time on your hands. Effective hand hygiene done at the right moment, in the right way, can break this chain of transmission of harmful organisms. The power to make a difference is in your hands. Your 4 moments for hand hygiene will break the chain of infection and safeguard your home, your residents, and you. Moment number 1. Always clean before initial contact with the residence or residence environment. Hand hygiene is required before initial contact to protect the resident from harmful organisms carried on hands from the home environment outside the resident's room. Clean your hands when entering the resident's room before you touch the resident or their area. Moment number 2. Clean your hands immediately before any aseptic procedure to protect the resident against harmful organisms, including the resident's own organisms, entering the body. Your training has always emphasized the importance of aseptic preparation. Make sure you also help others on the team observe it when needed. Aseptic procedures in long-term care might include applying bandages, eye drops, oral dental care, catheter insertion, preparation of medication, or changing a dressing. Moment number 3. Clean your hands immediately after any exposure risk to body fluids to protect yourself. Exposure to body fluids may come from handling waste, urine, feces, vomit, blood, or from such procedures as exposure to non-intact skin, wound dressing, injections, drawing blood, oral care, feeding, or any other potential fluid contact. Protective gloves should be used if exposure to body fluids is anticipated. Gloves must be changed after each task so organisms are not transmitted on gloves. Always clean hands after glove removal. Hand hygiene must be performed immediately after body fluid exposure risk before touching either the resident again or any surface and object within the resident's room to protect yourself and the healthcare environment from harmful resident organisms. Another example is cleaning hands whenever providing continence care or toileting. Moment number 4. Leaving the resident environment after touching the resident or any objects or furniture in that environment is the final moment in the 4-moment cycle. Before you contact any other part of the home, your hands need to be clean. Cleaning your hands reduces the transmission of organisms, protecting you and the overall environment of the home. When you are assisting with any activity in other areas of the home, such as the hallways and treatment rooms, you need to clean your hands before beginning and after ending the activity. Whenever you have to perform direct care with a resident, no matter where you are, the 4 moments must be followed. We define direct care as providing hands-on care, such as bathing, washing or turning a resident, changing clothes or providing continence care, changing dressings, and caring for open wounds or lesions, and toileting. Feeding residents or giving any kind of snacks, meals, or drinks is an activity that also asks you to be aware of the 4 moments. Moment number 1. Clean your hands and the hands of the resident before feeding them. Moment number 2. If you're going to touch the inside of the resident's mouth while feeding, you need to clean before putting on gloves to do so. Moment number 3. If during the feeding there is any body fluid exposure risk, such as saliva or mucus, then you need to clean your hands again to protect yourself and before feeding another resident. Moment number 4. Clean after the activity is finished. Hand hygiene is the single most effective practice we have to reduce healthcare-associated infections in our home. Look after your hands and look after your health. Just clean your hands.